Chapter 1. The Good Doctor in Denial. The streets were bursting. The crowd at the March on Washington for gay, lesbian, and bi equal rights and liberation became overwhelming. Dr. Heiko Jessen was finding it difficult to remain calm. Over 1 million people attended the rally. It was a sunny, mild day in April 1993. The cherry blossoms were at the end of their bloom, filling the mall with soft pink and white blossoms. The flowers fell from the trees like a fragrant snow, filling the trees with beauty. Jessen needed a quiet spot to himself. He found a solitary bench far from the talks and demonstrations. As he sat, thousands of miles away from his home in Berlin, one circular train of thought occupied his mind. Andrew. While Andrew stood only a few hundred feet away in the crowd, emotionally he was distant. Their relationship was faltering. Andrew had cheated on him, yes, but Jessen forgave him because he loved him. Now Andrew was complaining of a cold. For most people, a family member complaining of a cold is thoroughly normal. For physicians accustomed to easing the fears of their family and friends, a cold is certainly nothing to be worried about. But Jessen is not like most doctors. As Andrew complained of a sore throat, lethargy, a fever, and then a rash, Jessen became increasingly concerned. His thinking was guided by his experience in his small clinic in Berlin. Every day he saw the same constellation of symptoms. He spoke to young men who were battling what appeared to be the flu. Yet, in the back of their minds, was one event. A night spent with a partner they had just met. A party they couldn't quite remember. A struggle to put on a condom. Many patients were highly specific, detailing their exposure, able to remember the day and hour they became infected. This is because an influenza virus didn't cause their illness. It was often another, very different virus. In medicine, a prodrome is a set of symptoms that heralds the beginning of a disease. These first symptoms are distinct from the disease itself, with traits shared among similar pathogens. Viruses, for example, share a common set of prodromal symptoms. Before we run a fever, get the chills, and become hopelessly nauseated, we usually get an achy, tired feeling. This feeling serves as a warning to our bodies, a signal that we're about to get sick. Some viruses, like shingles and other herpes, share similar beginnings as the virus begins to invade. The virus first goes through an incubation phase. Like an egg sitting in an incubator, the virus hides in our bodies, waiting until it's ready to make its presence known. It is rapidly expanding during this time, madly replicating. Incubation can last anywhere from minutes to decades, depending on the disease and the individual nature of the person infected. This stage provides the virus's chance to build itself up. It's almost as if the virus is training for the fight of its life. By the time it's ready to move to the next stage, revealing the first signs of disease, our immune system is already losing the fight. HIV, like many other viruses, spends the short incubation period wisely. The virus makes millions of copies of itself, all before the body can properly identify it and mount a tailored attack. By the time acute infection begins, tens of millions of viruses have invaded, not only attacking our blood cells, but entrenching itself in our tissues. The virus wipes out the immune system in the gut. It forms a long-lived reservoir in multiple organs, including lymph nodes and bone marrow. The virus hides out in resting immune cells, so called because they are no longer dividing. The virus integrates itself into the DNA of the cell and then goes dormant. When the cell wakes up again, years, even decades into the future, the virus will wake up with it, insidiously using the cell to make more of itself. These resting T cells are like rare gems in a mine of rocks. Despite their scarcity, HIV is able to discover them. In its isolated hiding place, HIV can remain undetected for decades, beyond the touch of antiviral drugs. The latent virus remains present, but is not obvious, at least to the immune system or to our drugs. This is why we can't fully remove the virus with the therapies we have today.